Hey friends, welcome back to Casa, your home for all things nursing made simple and fun. Today we are learning how to give a Lovenox injection. If you're a nurse or a patient being discharged with Lovenox, this is a must-know skill. So grab your supplies and let's get right into it. Beginning with what you'll need. So most importantly, you will need your gloves and Lovenox, that is a pre-filled syringe, alcohol swab, a sharps container, and cotton ball or gauze. Super simple, right? You don't even need to draw anything up because the Lovenox comes pre-filled and ready to go. Some quick facts about Lovenox. It is a low molecular weight heparin used to prevent blood clots. This medication is commonly used for patients that just had surgery or for patients that have limited mobility. It is given subcutaneously, typically administered in the abdomen near the belly button area at the same time every day. Now let's go straight into the 8 simple steps. Step 1, wash your hands and apply your gloves. Step 2, choose your injection site. Choose a spot at least 2 inches away from your belly button and avoid scar tissue. Make sure to alternate sides each time. Step 3, clean the site. Using your alcohol swab, clean it in a circular motion and allow it to air dry. Step 4, prepare the syringe. Understand the parts of the syringe. So this is the barrel, this is the plunger, and this is the needle cap. Holding the barrel, safely remove the needle cap. You will likely see a round single bubble, which is common. Do not push out the air bubble. That air bubble will help seal the med under the skin. Step 5, pinch an inch. Pinch the skin like a little tent. This ensures we are in the fatty layer. Step 6, inject the medication at a 90-degree angle. Think of a dart and aim like it's a dart. Once injected steadily, no need to aspirate. Step 7, inject the medication slowly. Make sure to take your time. Slow and steady reduces the risk of bruising. Step 8, remove and activate the safety guard that is installed. You'll hear a click and dispose of in the sharps container. Here are some pro tips. Do not rub or massage the site after injection. It can cause bruising. Remember to always rotate sites. Do not inject in the same location twice in a row. Also, be consistent. Same time, every day for best results. And don't forget to always dispose of your needles in an approved sharps container. Remember, as you're teaching your patient, if your patient has a visual problem or has limited mobility with their hands, the patient should not be self-administering their own medication. You'll want to consider getting social services on board for a referral to home health so an RN can come to the patient's home to help administer the medication or assign a family member that is easily teachable. Boom! You just nailed your Lovenox injection training. Good job. Be sure to comment below if you want more nursing skill videos. Don't forget to subscribe, like this video, and share with someone in need. Thanks for being part of the Casa crew, and I'll catch you on the next one. Take care.